वेट करते हैं.
Hello. নাই আজকে তো সব স্বনামধন্য লোকজন জয়েন করছে। আমি তাই নন্দী সাহেব আজকে সময় পেয়েছেন। Sorry, ma'am, for the light, please. Okay. Whenever the president feels right, we are ready to go.
Shall we start? Is there someone left?
Just a moment, yeah. एक मिनट मेरे को YouTube का वो कर लेने दे, सेट करने दे YouTube.
तो त्रिपाठी को फोन कर ले.
नहीं, she joined. She joined.
She joined. Okay.
I'm very much here, ma'am. Good evening.
Yeah, good evening. How are you?
I am good.
Good. Nice to see you.
Yes, so good evening, everybody. I would invite our president to start today's meeting proceedings.
Yeah. Good evening, everyone. On behalf of the West Bengal Society for Study of Pain, I welcome you all for today's webinar. Today we have very important topic because all the pain condition, chronic pain condition, they affect the psychological effects are always there. And in fact, the biofeedback and the CBT, the cognitive behavior therapy, has a major role in pain management. Because this chronic pain, actually, they slowly affect the body, and there is an association between the mind and body. And today we have very good speaker, in fact, and Dr. Anirban Pal, who is doing for a long time this therapy, and there are successful results. And Dr. Mrs. Tripathi is also there. She will tell us how we can treat the chronic pain by this psychological, what are the psychological effect of the chronic pain and how we can treat. So let's start. I welcome you all. I welcome Dr. Manjushri Ray, our past president and of ISSP, West Bengal Society for Study of Pain, and ISA, to say something. And we are very happy today she joined.
Thank you, Krishna. In fact, I'm also enjoying all of your association, and especially the topic, today's topic. I think it is a very important topic, and I thought this is the time I must enrich myself, because any chronic element, forget about the pain, but any chronic suffering, that has some effects on our psychology, and it is very important to keep our everything positive way. So I'm sure today's meeting and the speaker, they will give some new direction, some new clue, so that we can also treat our patient in a better way. So psychological factor can also be treated along with their pain and other sufferings.
Yes. So all Sanjay start.
Yes, ma'am. With your permission, thank you very much. Welcome. This is our endeavor to start ECME is in the, and our aim here has been to introduce some off the screen topics or something which are very relevant, easy to implement interventions, easy, cheap, and widely available. So in that series, starting from lignocaine, today lignocaine, and then magnesium, and then intrathecal steroid. Today is our fourth ECME in the line. Without wasting much time, I would invite our first speaker, Mrs. Tripathi, who is a clinical psychologist, and she has a vast experience, has been working in a private setups at Bellevue and Columbia Asia Hospital, and she has a good experience working with chronic pain. Mr. Tripathi, please take over. Thank you very much. I go off.
Thank you so much, Sanjay, and thank you all for inviting me in this forum. Before I start anything, I think when we talk about human mind, when we talk about us, something which is very special and very unique in all of us is that we have a thought process, the cognitive ability which makes us superior from other living organisms. So when it comes to any emotion, whether it is happiness, whether it is sadness, whether it is pain, sorrow, everything is somewhere related to pain or related to our cognitive ability. So what happens is that the mind processes the concept, what we are feeling or what we are going through, and accordingly we start responding. So when I'm talking about chronic pain, I think there are two things which I would like to focus here. One is that monitoring of the pain is very important, because most of the time when we talk to our patients, most of their pain is related to somatic form of disorder. I mean, the feeling of pain comes first, and clinically there is some issue which puts them into pain. So I would always suggest that whenever I meet somebody, or when I go see my patients indoor, outdoors, I always ask them, what happens? Do you feel the pain first and then you look at your wound, or what happens? What is the interval you're... So when I'm talking about chronic pain, I think there are two things which I would like to focus here. Patients one is that monitoring of the pain mostly when I'm alone. Because when I ask of them, do you get pain to a patient? When you are with your most of their pain is when you're watching your favorite television. I mean, the feeling of pain. Do you get pain first? And clinically, there is some issue which puts them. So from there it starts. So how do I would always suggest that whenever I meet somebody, when I go see my patients in the outdoors, I always ask them. First is, what pain can be psychological. Do you feel the pain first? Second, of course, and then you look at your wound, or what happens. The clinical what is the interval you're... So when I'm talking about psychological, most of the cases when it is psychological, I would like to focus. The duration, one is that monitoring frequency mostly varies from person to person. Because when I ask of them, do you get most of the patients when it is your when you're watching your favorite television. So sometimes what we do, so pain, do you get pain? If you ask me, I majorly there is some issue which puts them. So from there it starts. So how do I would always suggest whenever I meet somebody, or when I go see my patient, I always ask them first condition. What happens? Why? Because you feel the pain most of the time, and then you brain which signals what is the interval you're... When I'm talking about this, because most of the time we are aware of the duration. One is we fail to understand mostly varies from person to person. Because when I ask them, most of your patients, when it is your most of their when you television counseling, basic counseling is provided. Pain enhanced knowledge. Make the patient understand what is from there it starts. So how do I, because most of the time when they do not know somebody, it can be what can be the clinical or physical condition. I always ask them first what can be the psychological condition, what are the thoughts, and then you look most of the time the thought processes of the mind. What is the interval? When I'm talking about this, because most of the time they do not know where it is actually coming from. The physical condition, they are mostly where it is a person. Because when I ask what is the emotional condition and it is a very so we ask them, can you monitor counseling? Can you counseling pain enhanced knowledge? What are the times you are getting discharged? Do you get same kind of pain? Because most of the time when they do have somebody, it can be so that's when we see the physical condition. I always ask them first. So it is, but obviously we talk about the pain. What are half of pain cycle? Most of the time under a medical condition, the pain condition. We're not talking about this because most of the time they are not post physical condition. When the patient is in medical condition, recovery stage, it is 7%. It is mostly the graph is rising and you end up so we are counseling, we are getting confused towards the durable or the timing of the stress. What we can see more heavy after the time when you start talking somebody, whether it's all I am doing situations, whether I will ask them to is but obviously whether back or not, so the time whether I have a medical condition, so these are certain things which we not most are physical condition, intervention is medical condition, no whether it is actually physical, mostly the graph is rising onwards. Secondly, when we talk about counseling, chronic pain cycle, psychotherapy, which includes more heavy relaxation to the time really when we talk about whether relaxation, whether second healthy lifestyle, which is but definitely affects back or not so the time whether the most important understand the circle also whether you are getting pain or intervention or even if after taking all the mostly the all the secondly, so it is a joint effort of the medical professionals or the doctors and the psychologists therapy which we can merge into the capacity of the really understanding when we talk about there could be an antecedent second lifestyle gradually can be or not the time whether so even if there is one baseline because of the medical condition you are getting or get condition you are being even if another technique which is mostly so it is a joint effort of the side professionals or the doctors and the psychologists. So we have seen in many studies merging the object is causes an antecedent second that is the time when a person who can actually understand what is he or she so we give them diversion. We try to alter they are into a situation. So this diverse joint so we have when we talk about diversion therapy, we ask them to exactly what happens, what kind of nature, what is the nature, and how painful it is. So that it becomes very easy then what is he or she understand the pain cycle. Number two, what we do alter is alter pain is very strongest. So this diverse joint which is more like important of the diversion therapy. For an example, somebody is in pain, when I'm talking to a small child, or small child maybe what is the nature and how painful he is experiencing because she is experiencing very easily what is that pain feeling of pain. And understand the pain cycle. Now we may what we ask the child water is favorite color. We may ask the child to be very strongest. So this statement that which is more and in this case what I would say important of the diversion therapy. For example, when I'm talking to a small child, or the same child maybe a person nature and how it is easy to come out of experiencing because she is experiencing very easily. I want that pain and understand the pain cycle. We may need the favorite color. So as a psychologist,
Thank you very much. Thank you very much.
Adequate. I would just like to supplement with some of my subjective experience as a pain physician. As a pain physician, what I have found that it's not easy to pick up the mental illness. First of all, I myself, I confess that I can't pick up the mental illness at the first go, or I have something, because I feel I am not adequately trained to pick up the associated mental illness. Secondly, if I suspect something, I want to talk to the patient about this mental illness or something. I find that most of the patients are not very comfortable talking about these things because the focus is on the pain problem. They don't want to talk with this part of the problem. And thirdly, if we refer them, mostly in my case, I have seen that if I referred them to a specialist who can help that person out with some therapies and other things, most of the patients, they don't even report to that person, that specialist. They don't reach out to that person. There may be different causes of that. So the depth of the problem is more, and the extent of problem is much more for us. As pain physicians, we are perhaps in a worse condition than other clinicians. So I come back to the question that is this topic important to us pain physicians? Yes, we are dealing with a very major problem in chronic pain patients, because if we are seeing 10 patients, if 7 or 8 of them have some psychological issues, so obviously this topic is very important. And I again give thanks to the persons who have selected this topic and given me a chance to speak about this. Now let's start with something which we already know. We know this from the books we have read. Some necessary information we already know. All of us know that pain is an unpleasant sensory and emotional experience. But as pain physicians or as trainees or whatever, our main focus was on the sensory part. But it's also an emotional experience. We need to know this. And we have seen that when treating the patients, many chronic patients, pain patients, they suffer from a lot of negative affect, like the low mood, anxiety, depression. These are things, they're almost associated with most of the patients. And this negative affect, this does influence the experience of pain. And we have also seen that there are individual vulnerabilities to suffering, that some patients, what Madam was talking, that some patients, they are happy despite having pain, but some patients, they just give away to this pain and there is only pain in their life and everything else in their life disappears. So there are individual vulnerabilities. And standard treatments, yes, cognitive behavioral therapy. This is the gold standard therapy. We also have mindfulness-based therapy. These are something which has been given in the textbooks, and these are used to counteract the negative affect problems. Now, what we want to know that do positive affect like cheerfulness, enthusiasm, joy, that is positive feelings, do they have any influence on chronic pain? We know that negative effect has a lot of influence. Do the positive effect, do they have any influence on chronic pain? And we also want to know that are there some simpler or cheaper techniques for the treatment? Because my experience with CBT, I have referred a lot of patients for CBT, but there are some issues with CBT because there are very few specialists are there who are doing this CBT in Kolkata, at least a handful of them. And moreover, the patients who go for the CBT, there is, I don't know, there is some problem with that either they are unable to continue the therapy, there is lack of commitment on their part, or there are financial issues on their part, and there is a very large number of dropouts. I think many of you will agree with me on this part, because very few persons are there who have completed the treatment and then have gained the positive effects of that treatment. So can we have some simpler and cheaper techniques? And can some techniques be used which can be used by the patient himself or herself? Some self-therapies which the patient can use whenever required. And can newer technologies, because of the technological advancement, the internet is there, We are presently in a ECME, and this is because of the technologies. So can we use this sort of technologies or the virtual reality, which are computer-based technologies in a simulated environment? Can we use these technologies for the treatment of the patients? And usually we talk about one-to-one therapy. The patient goes to the therapist gives the therapy. This is the usual form of therapy. But can we have a treatment where a group of patients, a group of persons, they are treated together? So if this happens, that will be easier to reach out to a lot more of the patients and to give them a cheaper and a simpler treatment. So let's see. Before we proceed, let's get a little bit acquainted with the terminologies which will be used in different articles. One is positive effect. We have already talked about this. This includes the positive mood and positive emotions like cheerfulness, enthusiasm, joy. These are all positive effects. And there has been some important developments in the recent years. There is a new domain of psychology which has come, which is called the positive psychology. It has come in the 1998, and it emphasizes mostly on happiness, well-being, and positivity. And there are a few exercises, mental things, which ma'am was talking just before me. And there are certain types of exercises which are called positive psychological interventions, which focus towards the good and the pleasant experiences of life and foster positive attitudes. There are some other terms. One term is very important called the resilience. We all know this, that I was talking that a patient suffering from pain, there is individual variability. Some patients take it able to cope with the situation well, they adapt with the situation well. So if there is a helpful functioning in whatever adversity that the person is facing, that is called resilience. The patient has good resilience. And if not, then the person is lower on resilience. And optimism is another term. We have already seen that this term was used in the dictionaries and the Wikipedia. It's just a tendency to expect that good things will happen in future. We know optimism. Now coming to the research evidences, what research evidences we have. Now this was my expression when I started searching for them. Are there any research evidences with positive thinking and chronic pain? But fortunately there are. So let's start with a pilot study. It was published in 2015 in Scandinavian Journal of Pain. A very interesting title given, Happy Despite Pain, a pilot study of positive psychological interventions for patients with chronic pain. An advertisement was given in the newspaper where 53 persons responded, and they were screened, and mostly low back pain patients who were suffering for more than 3 months. They were taken. There were 5 participants, and the study was in form of questionnaire. And what they found, they concluded that positive psychological interventions, these are those exercises which I was talking about, they have a beneficial effect on the chronic pain patients. And they can be an advantageous complement to enhance the effect of other interventions. So something positive coming out. In the same year, in the 2015, there was a review article in the Clinical Journal of Pain. And the title of the article was The Role of Positive Affect in Pain and Its Treatment. This article, it summarized the available literature on positive affect and pain. And they also suggested few future treatment development, how this research can be taken further regarding its positive effect and pain. And what they concluded, that this positive effect, if you have a higher positive effect, it will decrease the effect of pain, the perception of pain, as well as the negative affective responses, that is the anxiety, depression, low mood, that will counteract. And if you have absence of this positive effect, then there are poor pain related outcomes. These are the patients with low resiliency, those who are not resilient if there is an absence of positive effect, and they will have poorer outcomes. And they supported the interventions which are targeted towards this positive effect, and they also suggested a model called the upward spiral model by which this positive effect can be applied. Just after 2 years, in 2017, in the current rheumatology reports journal, one article, it was a review article again, and this article was fascinating because it presented some facts, some newer dimensions. The article was named "Can Positive Effect Attenuate Persistent Pain? State of the Art and Clinical Implications." This article, it said that positive effect lowers pain intensity, gives higher pain tolerance, it diminishes the pain disability, and improves the quality of life. But what was the fascinating part of this article, that it said that it can be administered, this positive effect exercises or the positive psychological interventions, they can be administered via online platforms, text messages, or through virtual reality. That was excellent. And it also said that the methods of administration are limitless, and they can provide a low-cost internet-based treatment, and with or without the guidance of a therapist. The therapist may not be directly involved. The therapist may be somewhere behind the scene. Some more important things, it said that the positive effect interventions, they can be an alternative to the gold standard treatment, CBT. So you have an alternative of CBT. They said that it can be combined with CBT to get more effects, and it can optimize other treatments also. So a lot of things. Now in 2018, the European Journal of Pain, there was an article called, very interesting name, "Filling the Glass: Effects of a Positive Psychology Intervention on Executive Task Performance in Chronic Pain Patients." Here, they are not just examining the pain part, they are seeing the effect of the intervention on executive task performance, which is something to do with patient's family life, his professional work, his productivity, his employment. And this article was also fascinating in the sense because what they examined was an online program, an online positive psychological intervention program was tested, and there were 74 subjects who were given this positive psychology interventions through online. It was an 8-week online program, and they had also controls, 48 waitlisted controls. What they concluded, that this online self-help program, it was able to improve the emotional well-being of the chronic pain patients. It's very important because we said that the pain is a sensory and emotional experience. Here, the emotional component is being improved. But these positive psychology interventions, they were unable to improve the executive task performance, which was the goal of the study. So that was the negative side of the study. In 2018, another very important article, it was published in JAMA. It was a randomized controlled trial, and this trial was done in osteoarthritis patients, another group of patients which are very common to us, and the number of patients is also very large, 360 patients. And there they tested a positive psychological intervention which was telephone based. So the previous study was on internet based intervention. This one is on telephone-based intervention. And their primary outcome was the WOMAC score. And what they found out that the WOMAC score has decreased significantly over time, but the difference was small. It was not a large difference. And what they finally concluded that they do not support this positive psychology interventions as a standalone treatment. So they said that the things improved. It was good, but they don't support the data didn't support that they can be used only as a form of treatment, as a form of psychological treatment. Now comes a very recent article published in June 2020, just 2 months back, and it was a systemic review and a meta-analysis published in one of the very important journals called Pain. And here adults with chronic non-cancer pain, they were taken into consideration. And what is the effect of positive effect and pain severity that was seen in this review. They meta-analyzed 29 studies, and what they concluded that positive effect inversely impacts the pain severity. And it also promotes resilience. Positive effect also promotes resilience. So that was their conclusion from this meta-analysis. Now something more. I think the evidences are quite good enough, but something more in that sense is something more interesting. Yes, we know fibromyalgia is a condition which is very difficult to treat for the pain physicians. Now in 2013, there was a pilot study which used virtual reality in the treatment of fibromyalgia. It was a pilot study with only 6 persons, and they used this in a group setting, and there was CBT given, there was group CBT given, and in a virtual environment. What they concluded, this study, that there is significant reduction in pain and depression among this patient, and they claim that this is the first study to use virtual reality in fibromyalgia patients. Another study in 2014 with 40 patients. This, if you see the title of this study, is very interesting. Virtual reality as a distraction technique in chronic pain patients. My previous speaker, ma'am, she was telling to distract the patients. There are different methods of distracting the patients. So here virtual reality is being used to distract the patients. And what they concluded, this study, there was some objective outcome where they said that virtual reality is effective at reducing pain. There were some subjective outcomes, but several patients reported that it's very encouraging. I have gone through the entire article where a lot of patients, they say that this is for the first time they have felt pain-free for a few minutes or hours in their life, because it so happens in a chronic pain patient, they have been suffering for so long, and they have been always concentrating on this pain. So for when you get them into virtual reality, for a few minutes, for the first time in life, they feel that they're outside this pain. And that's why they concluded that this technology is significant not only in reducing pain, but also in eliminating the interruptive nature of pain, because in their life, pain has intruded in so many ways that there is only pain in their life, and all the other dimensions of life has disappeared. So it was helpful to eliminate the interruptive nature of chronic pain, this virtual reality. Now just we're coming to the end of this presentation. So how this positive effect actually acts. It helps to attenuate both peripheral and central pain facilitation to reduction of inflammation. There are a lot of theories about this. And one major thing it does, the positive effect, it broadens the scope of attention. What I was telling, that these patients, they get biased to negative stimuli and they pick up these negative things very quickly. So what positive effect does, it counteracts that and broadens the attention. So it's not only pain centric, everything is not pain centric. And many of these patients, they catastrophize the pain. They make the pain so big that the pain covers the entire life. So it helps to get them out of this pain catastrophization. And there are other mechanisms also. It helps them to engage in different activities of life because something happens in them that they understand that pain is only a part of my life. It's not the whole of my life. So they start engaging themselves in different valued activities, in other activities. And it also, positive effect also alters the learning processes. So the take-home points from today's session. A very large number of chronic pain patients have associated psychological problems. Sometimes we are unable to pick them up also. Very grossly, maybe out of 10 patients, if we are seeing, maybe 7 or 8 out of them are having some sort of psychological problems. And even the patients are not also allowing us to get into those problems. The positive psychology interventions, they can help chronic pain patients because most of the articles were positive results giving, and even the systemic analysis, the meta-analysis and the systemic reviews, they have a positive ending saying that the positive psychology interventions are helpful, and they can be combined with other treatment modalities. Yes, it's not that you have to give it as a single modality, as a standalone treatment. You can combine them with other things. The techniques can be simple. We have seen that there have been online programs, there have been telephone-based programs, where the newer technologies are being used, the different forms. Virtual reality has been used. And when the techniques are used for a mass, obviously the techniques will be of low cost. And sometimes the therapies may not be directly used. So thank you all for patient listening. I am grateful to you all if I have added something new or valuable to your knowledge. Thank you.
Thank you so very much, Dr. Pal. It was quite top heavy, shall I say? Yes, it was. I would invite all our seniors and other members, but before that, just one clarification. I'm just a general secretary. Our scientific secretary is Dr. Ramapati Chanyal, not me. Number one. Number two, for clarification, this topic was suggested by none other than Dr. Subroto Goswami sir. And he specifically wanted Dr. Pal to talk about it. So there you are. And yes, anybody, any comments, any questions, anything? Because our psychologist ma'am, Ms. Tripathi, is in a bit of, unfortunately, she has to leave. I think she might have left already because she had some prior engagements.
I was
Oh,
seeing.
you're around, ma'am. Thanks a lot. Thanks a lot for being around. Ma'am, because I think, I don't know if others have a question, but my question is simple that how do I send a patient to a psychologist? Because even when I give amitriptyline 10 milligram, I have got phone calls. आप हमारी माँ को पागल समझते हैं, आप हमारी माँ को हमारे अपने पागल की दवाई दी है. So if I say psychology or psychiatry, yeah, I had it.
I think the most important part here is that there is a difference between mental health and mental illness. So when we are talking about a psychologist, they're basically always into mental health. And psychiatrists are the people who are giving medications and doing the mental illness treatment. But one thing is that medicine is a support which definitely helps you stay where you are. But when you talk about a therapy or you go to a psychologist, number one advantage is you get to talk to somebody or share with somebody who's a trusted individual and who is going to be genuine. And secondly, it will give you a third eye vision. I always, whenever people ask me, why do we go to a psychologist? Uske paas kyun jana? Pagal thodi na hai. I always tell them she or he will give you a third eye vision, which you are probably omitting, which we usually do. It's basically checking, rechecking, and revising. So you check, recheck with your doctor, to revise, go to a psychologist. So she will help you with that.
Yeah, definitely. What you're saying is true, but the thing is like amitriptyline 10 milligram is not exactly a psychiatry intervention. It is more working at a different level. But then they Google it up and find amitriptyline is an antipsychotic or something like that, and they invariably will get back. And definitely, gradually, we pain physicians, thanks to availability of the psychologists and people who understand and who work specifically for pain, it helps us in the sense that certain people, we are sending patients to the physiotherapist till date. Now we are sending them to the psychotherapist also, because the psyche is part of your totality. It's not just the physics, it's your psyche also. So that's the reason. If anybody else has a question with Mr. Pati or else, and then we will bombard our colleague Dr. Anirban Pal. We have a lot of questions for him. So I think yes. Maybe we'll come back to you some other day time when we have gone through more, Mr. Pati, and I hope you will be available to interact with us at a different level. Dr. Pal, you have anything to ask or add or talk?
I would just like to ask ma'am that when you are giving CBT to some chronic pain patients, usually how long is the duration of the therapy?
So basically what we do is first session is more than, it's like 1 hour 40 minutes. I never count the first session because that is the time the confidence comes in, and you create a place in your client's mind that okay, she's the one who can help. So there is no restriction in that. So for all of my first session patient, I have no time. So usually within 2 hours I finish. Yes, once we start every week for consecutive 3 months, and once in every week actually, and then post 3 months it is once in every fortnight. 5th and 6th month it is once only in a month, because I basically practice with a diary. So every session has couple of questions which they need to prepare and come back to me. And post 4th session, they have my questions from my end which they have to answer. So I give them situations. So I try to develop understanding. I try to make them better decision maker. At the same time, we develop acceptance and adaptability. So majorly we work on these. This is how I work for CBT. So as of now, I can say that people have not come back to me with the same concept. They've come back to me with a greeting card or maybe a marriage invitation card that they're doing well, but they've not come back to me. There is a disadvantage also that many therapist friends of mine, they say that once they're cured, they're not going to come back. But that's what I mean. They shouldn't come back to me with the same problem. So that's what I do.
Thank you.
Ma'am, there are 2 questions for you, I think. We are not letting you go, apparently. One is that a very relevant question. In Kolkata, any online psychological counseling, psychologists is available during the COVID pandemic. I believe you are doing online counseling.
I'm doing online. I'm doing COVID face-to-face in the morning. So I'm in the COVID wards in the morning hours. Post 5 o'clock, I'm doing online for all my patients. Saturday, Sundays, I have weekly off, so I'm doing that as well. Apart from that, it is a state government protocol now. We have online counseling available, which is basically supported by Raja Bajar Science College. They are providing counseling for patients, but every hospital has also started with telecounseling services, including Bellevue. So we are doing it this way. Even Columbia Asia has their online counseling facilities. All are doing.
For non-COVID patient as well.
Yes, sir.
Okay, I think Dr. Basak, your question is answered. Dr. Joshi, please go ahead. It's your question now.
Yeah, good evening, ma'am. I just wanted to ask the question which is in line with Dr. Sanjay Patwari's query. What happens is he was talking about amitriptyline. I would deviate a little bit from that. What I wanted to ask is that could you please suggest us some examples, maybe of some sentences, some starting sentences, which would help us break the ice and guide the patient towards the psychologist? Because as soon as we start talking about the psychologist, especially for the fibromyalgia females, it becomes really difficult. Their facial reactions change, their behavior change, they become more apprehensive, they stop interacting with you as soon as you utter a word about the psychologist. So could you suggest us some maybe some good sentences to start with, so that we are so the way we express us to ourselves to go to the psychologist can be a little palatable for them?
So
basically Saurabh sahab asking ki pickup line kya honi chahiye to send the patient to the psychologist.
Yes sir, exactly.
So basically, when I go as a psychologist, because in our hospital, there is a protocol that the psychologist should meet each and every patient with or without referral as well. So, we start with a formal introduction and we start talking. But when you are referring, I think the best thing is to relate pain with expression. Because if you can express how you're feeling and how your pain is, that is going to give you the curative measures in a better way. So if you can, we may talk like that, do you want to talk to somebody regarding what you're feeling, regarding your emotional state of mind? Would you like to share somebody who would be not a part of your family or non-judgmental person? I can advise you or I can guide you for a counseling session.
Ma'am, you are right in saying that everyone should be sent to the psychologist, but the problem is that as soon as you utter the word psychologist, the situation changes. It is more difficult for the private practitioner sitting outside the hospital setup to refer the patient to a psychologist. So could you, it would be great if you could suggest us some words where to start with.
Dr. Pal, क्या होना चाहिए? I think it should be काउंसलर के पास जाएंगे.
गाड़ी घुमाना जो है ना, गाड़ी घुमाना becomes a little difficult.
It's very difficult to convince the patients.
जी sir.
It's very difficult to convince the patients, to motivate them to go to a psychologist, because whenever you say you go to a psychologist, you go to an expert, they would be totally silent, or they would just nod and go away, and they would never report. That is the usual scenario of the things. Very difficult in practical scenario to send to a psychologist.
I think of late things are changing also, because we have seen huge number of patients who are coming to express, and I think thanks to the educational setup now, I think school is having, or hospitals are having their full-time psychologists.
Yes.
They feel that talk therapy works, and then expression really helps. We can also suggest that why can't we find somebody who can support you with your emotional state at home maybe. Then let the patient say that there's no one who's listening to me. No one understands me. So would you like to go to somebody who would like to listen to your stuff maybe?
The answer for that is most of the time a big no. And that just finishes off the conversation actually.
So we need to probably change our name from.
But thank you for that, man. Thank you for that one.
Yes, I think on day one it will be really difficult for a patient, for me to send my patient to a psychologist. Gradually, when I build confidence with them, then they may listen to me. Everybody's conversing with the physiotherapy, but the psychotherapy is something they are not really ready to take up. So maybe after a few days, a couple of sessions with them, then you say, "Yaar, aap ek baar dikha lo, you have too many issues." When they have a confidence in you, I think you cannot send them on the day one itself.
Yeah, right.
That is my take.
In fact, I would suggest day one psychotherapy rather should not be sent, because the medicine should come into picture. It should control the whole critical stage of a patient, and then proceeding with therapy sessions really helps. I mean, that is what my personal experience is. That really helps when you're controlling the patient with the medication, and then somebody comes in as a psychotherapist.
Dr. Sanyal, do you have any questions? I think you wanted to say something.
I'd like to have some opinion from both the speakers regarding, like, let me come to the question with a small explanation so that I become very clear. We know that positive effect is a very important thing, and it usually comes with fulfillment of targets which are achievable, right? It may be very small target, but that gives us a satisfaction, and therefore fulfillment of target is one of the sides of positive effect. Discipline helps us fulfill this reaching the target what we plan for. And discipline is nothing but achieving small targets which are achievable. I would like to ask the opinion of both the speakers regarding, because we haven't talked about discipline either. So is especially for the population in India where education might be, the rate of literacy might be very high, but mental maturity, so-called, I think is not that very high. Even our scriptures have very good mental maturity and everything can give us that, but actually the population doesn't have that. Now, I'd like to ask both the speakers, do you teach the importance of discipline for having a positive effect? Are there any literatures on it? Are there actually, whether it works? Have you put that to test, or what is your experience on this?
So, Dr. Pal, are you speaking first? You allow me?
No, ma'am, you first.
Okay. So I would explain discipline as maintaining a routine. So from the very first session, actually, if you ask me, without a routine, we cannot progress, because otherwise what happens? The psychotherapist would always want the patient to go step by step. To go step by step, you need a routine. So automatically, when you put a routine to your client's mind, that inculcates discipline in that person. Because we check on their sleep cycle, we check on their food cycle, we check whether they are exercising or not, we check whether they have their read time, are they relaxing or not, how occupied they are in their workplace, what are the stress busters, or what are the stress triggers for them. So this all taken into consideration, we provide them with a routine that you need to balance out. For balancing out, you need to have these things into your daily schedule. And I think a routine or a schedule is nothing but making somebody more disciplined, I guess. What do you say, Dr. Pal, please?
Actually, sir has put forward a very important question. As I am into mindfulness, mindfulness is basically a mental discipline. So a person who doesn't have a discipline in his life, how he can practice mental discipline, because that is some grade higher. So this is very important. What we try to motivate the persons who are coming, the patients who are coming, to slowly get into this discipline. And I don't know, we can very well predict even within 1 week of the start of these sessions or courses in mindfulness, we can jolly well predict the persons who had this discipline in them or who go into some sort of discipline, they have extraordinary results, very good results. Even we can predict that before the sessions. But the persons who lack this discipline in their life, I know from the start that these therapies or everything is going to be a total waste of time and waste of effort from the both ends. So discipline is very important. But it happens that some persons are there, maybe 20% of the total or 30%. They don't develop the discipline even during the sessions or even during the courses. They are unable to get into that. So they are total failures. Very important thing, discipline. It
Thank
makes
you.
or breaks the thing.
Thank you.
I think, with the permission, we can excuse Mr. Party. Thanks a lot for being with us. We will catch you definitely in the future.
Thank you, sir.
So-
Thank you all. It was a wonderful session. Dr. Pal, there's a lot of things I need to, discuss and learn from you. So
Me
definitely,
too, ma'am.
I'm going to get back to you all soon.
Sure, ma'am. Sure.
Thank you, Sanjay ji. Thank you so much. Thank you so much.
Thank you, ma'am. The boss, the person who suggested this topic to begin with, Dr. Goswami is very much here. So I would request Dr. Goswami Subroto to say something, ask something, comment on it. We will be grateful. Because this is a topic you suggested to me. And you suggested that Anirban Pal should talk about it.
Yes, and he did really good. And
yeah, he did a beautiful justice to the
always
fantastic.
always he to like this. So it was very nice listening. Sorry because I came late from my clinic, so it was late. And anyway, it was very nice and thought-provoking, and thought-provoking also. We need to think about it. Future days, maybe we will have more sessions. We have to follow in everywhere. And regarding the question from Saurabh, I think Dr. Pal is trying hard, but we also should try a little bit to learn a little bit from him, that how to make rapport with a patient, how to get out of the patient, that whether are you sleeping well, are you waking up early, or are you not having the sleep after you going to retire, it takes some time. Like these leading questions, and are you depressed, are you feeling at times very depressed? In this way, indirectly, we can get some clue that that patient is in need of some support, some good listening, and some discussion. So I think these are the ways. We should also talk to the patient nicely. We should also make very good relationship, make them cope, to help them to cope with the problem. So these things definitely will win the patient, and the patient will be with me. And then I have seen, whenever I have seen the patient to psychologist, so they very gladly usually they go. But yes, it is true, on the first visit you cannot do that. So you have to spend some time with each patient of the chronic pain patient, at least 15-20 minutes. If you can spend, then I think the patient will be with you and he will listen to you. But anyway, thank you all very much, particularly our secretary and scientific secretary, for continuously provoking our thoughts.
I have just one question. Yes, sir. You said rightly that it is not day one that you can send your patient anywhere, or even day two. At times, even you need to develop a rapport and gain their trust with the constant uh, interaction and mindful listening. It is not just mindfulness, as Anirban Pal sir would definitely concur with me on this, that mindful listening to your patient also goes a long way. I have one question for Anirban. You said about, because I know you have not tried this and you are more in mindfulness, but still, nonetheless, when you say that with virtual reality, there have been studies where the patients have a few moments of pain-free bliss, right?
Yes, 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 yes.
So that was a study. So isn't that what exactly marijuana also, or ganja also does? Takes you off from your reality and takes you into a virtual reality, a non-existent
No,
reality, and takes you off the pain.
actually, Shanjada, I have a different way of looking into the thing. Uh, with the, I can, with everyone's permission, I would like to say a little bit of my experience with mindfulness in chronic pain patients. What we find there, because mindfulness and these positive psychological interventions are very closely related. They are not exactly the same, but there are a lot of things in common in mindfulness and these interventions, the positive psychology intervention. So what I have seen, what changes in the patient, chronic pain patients, is that their perspective of life changes, how they look into the pain condition changes. So I remember a few patients who at the end of the sessions, they would say that the pain is there, but we are looking into pain in a different form because I have my life. There are different dimensions of life. I want to lead my life. I want to enjoy my life. Okay, pain is a small part of my life. Maybe it's occupying 10 or 15% of my life. But what about the rest 85%? What about the 90% of the life I have? I have to enjoy that life. I have to go positively in that life. So the perspective of seeing the pain is here seen as a problem only. But what usually happens in other patients, the pain covers the whole 100% of the life. There is only pain and pain. There is catastrophizing of the pain. Okay, what will happen after 15 days? What will happen after 1 month? What will happen after 1 year? The pain is getting worse. The medicines are not working. The doctors are not uh, giving me adequate support. These sort of things come into mind, and all it is totally negative way of getting into things. So this something happens with this positivity, with this mindfulness, that the way of looking into the pain totally changes for the patient. So that is, I think, and they are not being, they are out of that world of pain. They are into their own world. They live their life in their own way. Pain is there. Pain is there. There is a component of pain is there. Even in many cases, I have seen the intensity of pain doesn't change much. Yeah, the studies have said that intensity of pain changes, but I have seen that doesn't change. But the looking into the pain, adapting to the pain, that totally changes.
So
So
basically,
that's
you're not allowing 10% to master the 90% of your
yes,
life.
yes, yes, yeah, you got it right. Yes, you got it right.
Yesterday I had a patient. So a couple came to me. Shora was also with me at that time. So that patient came from Srirampur to our institute, a long way, and it took 2.5 hours to reach our institute to visit a pain physician. The patient is having a severe pain in the iliac fossa, left iliac fossa, and the hypogastrium, and for last 1 year or so, or more than that. For that reason, the patient had a laparoscopic myomectomy also, because there was small tumor in the uterus. Also, in the laparoscopy, it was seen that there was some endometriosis, chocolate cyst, or adhesiolysis was done. And the gynecologist told that, yes, this will relieve the pain, but it didn't. So the patient is having again that adhesions and the pain, nagging pain again. So next time the surgeon told, no, it is very difficult. So then they went to another gynecologist. She gave some hormones. And with the hormones, they are telling that when I taking that medicine, yes, pain is a little bit reduced, but we want IVF. They went for an IVF, but IVF failed. And they're still trying for a child, and at times, but they're having severe pain. They came to me. So we discussed and we told that, madam, the cause of the pain is that adhesion and endometriosis, and you know this is due to, as long as your ovary will be functional, the endometriosis will be there. So either the medicines will suppress the activity of the ovary, or you will have this pain because the menstruation, but I told in a very simple language. But it seemed that nobody has explained the patient what is his problem. He does not know what is the problem. Pain due to fibroid, pain due to chocolate cyst, pain due to something else. And they are gradually accepting that they will not have any child. Now the other lady told, so get my all ovaries and uterus removed. I told, no, madam, nobody will do at this young age. Possibly you talk to the gynecologist, the medicine, these hormones will help you having the activity in reduced form. And by this time, do you plan for anything else like adoption? Then the husband told, yes, we want that because I can tolerate that. And we are discussing in that way, but at that time, Saurabh told me, sir, instead of writing, I gave some medicine so that they had good sleep, this antidepressant and those things. And at the same time, Saurabh also suggested me, can you suggest Dr. Anirban Pal? Yes, immediately came into mind. I gave thanks to Saurabh and told the patient, can you meet Dr. Anirban Pal? I know he will help you. He will listen to you. He will understand your problem. And probably if you are very depressed and anxious at times and you don't know what to do, so please talk to him, visit him. They immediately accepted and they'll go. So in the first visit, I sent them to the psychologist or the psychiatrist or the interventionalist, and the patient accepted. What I am telling that if the patient knows what is the problem inside, then the patient accepts that pain. And so that is my only yesterday's experience I shared just now.
Yes, sir, but the thing I think, thank you. Sorry, Anirban, I'm interrupting you. In the sense that, yes, if maybe the patient accepted the suggestion because Dr. Pal is another pain physician and not a psycho word is associated with him. If it had been a psychologist or psychiatrist, maybe they would have had a second thought.
No, I did not tell he's a pain physician. I did tell that he will help you. I did not tell that. They do not know that.
Okay. But you never uttered the psychologist or psychiatrist words.
Even when I was sending a patient to psychologist, I never uttered that.
Exactly. I think that is important. Yes, Anirban, you wanted to say
Yeah, I want to share one thing. I don't know Dr. Orgho is here or not.
I think he has left.
Okay. One of Dr. Orgho's colleagues, there was a similar incident. That lady was suffering from severe chronic pain and she has tried all the modalities. She has visited a number of pain physicians and etc. etc. And she was having a lot of pain and a lot of problems. So she came to me. She is one of our colleagues also. She went through this mindfulness sessions. One thing I want to mention here, she was a very dedicated person. And what Ramapati sir said, discipline, it was there from the day one. She was very disciplined. And when the thing started, the session started, I knew that we can have a very good result from her. And with the end of sessions, she is still with us. This is an incident which happened 1 year ago. She's still connected with us. She is a regular participant. The pain thing has almost disappeared from her life. She herself said that this mindfulness thing has totally changed her life. It is there. The pain is there. It's a chronic pelvic pain, similar sort of situation. She underwent operation or something, a lot of drugs she had taken, hormonal medicines and other things. She was totally disappointed with life and she was totally lost, but she has come back and now she says that pain is there. Maybe the score is 3 or less than 3, but she accepts that and she is going very fine with her life. So that the perspective towards seeing the pain has changed for her. And
Anirban,
yes,
what I was talking about discipline is not routinely the dictionary word of discipline.
yeah,
What
I
I was
understand.
talking about is discipline. What is the difference between discipline and ambition is, in a discipline, you set a target which is quite achievable and you
Yes,
achieve it.
yes.
In an ambition, you set up a target and you don't achieve it.
Yes.
Discipline gives a positive boost that
Yes,
you have achieved, even if it is achievable by 100% of the people. But when
yes.
you achieve it, that is a discipline. In an ambition, you have a target, you don't achieve it. By
Yes.
discipline, what I was asking you, I meant to say that this is what is a discipline. So in your cognitive behavioral therapy, whatever it is, in your mindfulness or all your yoga sessions, I think setting up a discipline. By discipline, I mean setting up targets which are easily
Yes.
achievable is an important part of this treatment. We don't think it this way. That's what I.
Yes.
Goals that you achieve.
Yes. When we start the sessions, we ask the
By the way,
participants.
Anirban, now you know why Ramapati is scientific secretary and I am general. I think you have understood the difference. Please go ahead.
We set up very small targets. We tell the participant to set a personal goal. Now, what Sir was telling, I am absolutely with Sir that some of them would set up such a goal which is not possible to achieve. They would set up such an ambitious goal. Then we just talk over and say that this goal cannot be achieved in 1 month or 2 months time. So you have to set up something which you can achieve, which is at least possible to achieve in this time. So they change their goals and we work towards getting to that small goal in this period of time. Exactly, sir. This is the way we also go in this way.
Yes. Anybody has any questions or comments to make? Dr. Shailesh has been an attentive listener. Usually we love to listen to him. I don't know whether it's there. So with your permission, because I think at the moment you are senior mood. Yes, Shailesh.
Just to share and you can get a video on the YouTube. It's just a different thing from what you are discussing today, but I think it's a quite interesting listening. It was between Barkha Dutt and our previous president Abdul Kalam. When Barkha Dutt said that we need development, what do you mean by a developed country, and gave economic indices? The definition that Dr. Kalam gave was, first, there are three targets for a development of a country. First is the economic development. Second is the education. And third, which all the nations miss, is family values. That family values is discipline. Very important. And that is, you can go to the YouTube and have a look at this. I haven't read any definition like this before. Right? And this is so very important. The family values and discipline, they are so very important. So that way the discipline is not a routine. It is basically some values which can be easily achieved, and they give a positive boost to the whole society or to the
Pranal sir. We'll be
Thank-
grateful if you can share the link on our platform. Yes, Dr. Shailesh, you wanted to say something? Your voice is breaking, sir. आवाज टूट रही है सर आपकी.
So
We can't listen here to what he's saying.
what? Anyways, thanks everyone. If I'm not audible, just thanks everyone.
And now you are
Wonderful
audible
session.
beautifully.
Okay, I'm audible. So just one sentence I would like to add. One of my uncles, he was some 80 years old, so he had come to meet me and he was telling he had pain in the knees. And I had a talk with him and then he only told me something which I remember for life. शैलेश, मैं घुटने के दर्द को इसका दर्द नहीं बनाना चाहता हूँ. मेरे घुटने का दर्द मेरे घुटने में ही रहेगा. घुटने का दर्द सिर दर्द नहीं बनने दूंगा. That was such positive outlook, such a positive sentence, such a beautiful sentence. I always remember this. Stress anything, it should be limited to that. What we were talking, that 10% of the pain and the rest of the life, it shouldn't be affecting. So that's what we have to achieve. And we have to help the patients also achieve that thing. With that, we have to understand